Hello, I'm Brooke Cook, and I'm the Public Health Director here at SJ, PhD, reporting live with WWJD News. There has been recent reporting of measles outbreak here in Silicon Valley. The origin is similar to that of 2014 measles outbreak in Disneyland, where an unvaccinated child under the age of 5 years old was infected and initiated a nationwide outbreak. Rubella, the scientific name for measles, is a highly contagious viral disease which is spread easily from person to person via cough and or sneeze droplets from the nose, throat, and mouth of an infected individual. The most vulnerable populations are individuals who have not been vaccinated for measles, particularly children under 5 years of age and adults older than 20 years of age. Although the measles epidemic in the United States was declared eradicated as of the year 2000, American adults and children who travel internationally need to ensure that they are properly vaccinated prior to doing so, as international traveling has been the primary cause of measles outbreak here in the United States. According to recent reports, 34 people from 11 states, including Arkansas, California, Illinois, Indiana, Kansas, Michigan, New York, Oklahoma, Pennsylvania, Tennessee, and Texas were infected with the illness between the time of January 1st to March 30th, 2018. Currently, most cases have been related to a 5-year-old unimmunized child and the people he encountered at Great America Amusement Park here in Santa Clara, California. Although there have been no reports of critical hospitalizations or mortality from this event, measles hospitalizes 1 out of 4 infected persons, causes brain swelling, encephalitis in 1 out of 1,000 persons, and results in mortality for 1 to 2 persons out of every 1,000 cases. If you feel you may have come in contact with someone infected with the measles, call your physician immediately and inform him or her of the situation. Additionally, children who are infected with the measles should be excluded from daycare until 5 days post-outbreak or after being released to do so from a doctor. Common symptoms for rubella generally include high fever, cough, runny nose, chorzolia, red watery eyes, conjunctivitis, and tiny white calyptic spots that appear in the person's mouth 2 to 3 days after being infected. These symptoms usually take effect within 7 to 14 days after a person's exposure, which is then shortly followed by a rash outbreak consisting of red raised bumps, which is generally formed around the hairline and spread down the neck, the trunk, arms, and feet and legs. Even though measles can make an individual very ill, in most cases, healthy children and adults fully recover from the illness, and once you've had measles, you cannot have it again. However, risk of serious complications from measles increase drastically for persons who have not been vaccinated or are not up to date with their vaccinations. In efforts to prevent chances of getting measles, it is important for both children and adults to get vaccinated. 2 applications of the measles, mumps, rubella MMR vaccine is proven to be 100% effective if the proper doses are taken within the prescribed time frame. As with any medications, there may be some side effects associated with the MMR vaccine. These may include, but are not limited to, sore arm, fever or rash, seizures, coma, and brain damage. Nonetheless, these side effects are rare and not worth running the risk of contracting measles due to vaccine negligence. So parents, please get yourselves and your children vaccinated if you have not done so already. If you have any uncertainty of your family's immunization history, access your medical shot records to make sure that you are up to date. And if you're not up to date, schedule an appointment with your doctor as soon as possible to ensure health and safety for yourself, your family members, and others. My name is Brooke Cook, and I'm signing out with WWJC News. Thank you.